Hello, good afternoon. I'm often asked, why does my knee feel like it's tearing at the front when I've had my knee replacement, when patients come and see me 6 weeks after their joint replacement? This is due to the body's natural propensity to tighten scar tissue up. This is what scar tissue is designed for. Initially, when the skin's healing after it's been breached, a scar forms, and then over time this scar then will tighten to try and bring the wound edges closer together. Now, obviously this works great if we have an injury and we're trying to fill a hole or a gap in the skin, but doesn't work so well when we're planning to do surgery. Obviously we weren't originally designed to have joint replacements, so unfortunately when you're working against the scar tissue, this is why it generates these sensations. Now, the main thing to do is to realise that you're not actually damaging the skin by doing this, and all you're doing is stretching out the scar tissue and allowing you to bend the knee further, which is the goal of the rehabilitation after a knee replacement. Because if you don't get the full range of motion afterwards, then you find that you can't do activities as well as you were hoping to do. So this is why you have to work against your body's natural healing response, unfortunately, and this is why you get that burning feeling or tearing sensation at the front of your knee through the scar when you're trying to go into a deeper flexion. The good news, however, is that it does come to an end once the healing process finishes, and the scar is a nice way of looking at how the underlying healing is going on, because initially scars are red when they've got the little vessels forming that grow into the area to aid healing, but once these are no longer needed and the healing process is finished, then these little vessels die away and the scar goes white. You may notice this on old scars you've got yourself that no longer look red and look pale. So it's a good indication of what's going on underneath and deeper to the scar itself. I hope that's helpful for you. Goodbye.